everybody?
Yes, sir.
Right.
Yeah, it is
Visible?
visible.
So this is the first question. So look at this X-ray carefully, and then we will go to the questions. Okay. So I've seen this X-ray carefully. Now the question is, give the formula to calculate the ratio used in antenatal ultrasound to prognosticate this condition.
Lung to head ratio.
LHR ratio. Okay. So you're right, it is LHR ratio. So what value in this ratio indicates a good prognosis?
Greater than 1.4, sir.
So not only you locate, everybody can answer. So you can, so everybody can answer in the chat box. I can see a lot of answers are there coming. So what ratio tells you that's a good prognosis? Greater than 45 is wrong answer. 225 is wrong answer. 0.4, 66%. Okay, so we go to the third one. Okay. So right answer is 1.4. The third part is, apart from this condition, name one more condition in which exit procedure is used. Exit procedure is used in which condition? You know what is exit procedure? Ex utero intrapartum treatment. F, no. Okay. So look at the answers now. Okay. So Dr. Shivani has raised her hand. Dr. Shivani, you can answer all three. Shivani, can you answer? You want to answer? So lung head ratio is calculated by length of the lung in centimeter, and it is normally the unaffected lung. And this X-ray you showed, it has right-sided diaphragmatic hernia. So you look at the left side of lung in this patient, multiply with the breadth of lung and divide by the head size in centimeter. So that is called lung head ratio, which is calculated in diaphragmatic hernia in antenatal ultrasounds. If it is more than 1.4, it tells you a good prognosis. And in this, you know, you can do exit procedure, and tracheal plugging is done. So apart from diaphragmatic hernia, you can do exit procedure for fetal airway malformations like goiter, tumor, or congenital cystoid malformations. So we have done one for massive goiter at our center, but yes, exit procedure can be done if you want. You know that as soon as the baby comes out, he will not be able to breathe. Okay. So should we go to the next OSCE? Next OSCE is a full-term newborn was born by normal vaginal delivery and was discharged on day 3 of life. Baby is readmitted on day 7 with fast breathing and is in encephalopathy. The workup shows normal sepsis profile, normal X-ray chest, normal liver function test, serum ammonia of 500 millimoles per liter with no metabolic acidosis. Okay. So what neonatal procedure can be life-saving in this condition? So PD, dialysis, peritoneal dialysis. So you're right, most of you have picked up right. This is peritoneal dialysis. Or you can do hemodialysis. So right now, most of the people are, we are doing peritoneal dialysis, and you can see the diagnosis. Diagnosis is urea cycle defect, but I have not asked you the diagnosis, I asked you the procedure. So name an amino acid which can be used as medical treatment of this disorder. So name the drug medical in which can be used in urea cycle defect. Arginine, right? Anushka Kulkarni has answered it right. Ankita Bhagat also, arginine. That's right. Rajesh Singh, definitely right. Okay. So the commonly used medication in this disorder removes ammonia from the body as. So we use normally sodium benzoate. So how does ammonia gets out of system by using sodium? So sodium benzoate is a drug which is used, but the ammonia is removed from the body as what? Sodium benzoate does what to the ammonia? That is the question. So this is urea cycle defect, right? You do peritoneal dialysis, correct? You can use arginine, but how does ammonia comes out of body? So the answer is glycine. It comes out of body as glycine, right? So come to the third OSCE. Look at this X-ray. Okay. Now the question is identify this X-ray. PIE, right? This is pulmonary interstitial emphysema, very right. PIE, correct. So most of you have picked up correctly. This is PIE. Now the next question is, why can a child recover from bronchopulmonary dysplasia, but an adult cannot repair the lung injury seen in emphysema? So BPD can be equated to emphysema. So why can a newborn repair its BPD, but the adult who gets into COPD or emphysema cannot repair the lung? Type 2 pneumocytes, very right. So you have type 2 pneumocytes. Anushka has answered correctly, which will help in the growth of the lung, which are not there in adults. Very correct. And can you calculate the oxygen index of this patient? MAP is 8 centimeter of water, FiO2 is 0.5, and PO2 is 80 millimeter of mercury. Just calculate the oxygenation index. Can you show the X-ray again, please? So I will show you once more, but just right now calculate the oxygenation index, then I show you the X-ray again. The simple calculation for oxygen index, MAP into FiO2 divided by PO2. So I think most of you have picked it correctly. So I first show you the X-ray and then we go back to the questions. So this baby is showing a chronic lung disease and pulmonary intestinal emphysema. You can see this baby is still intubated. You can see that this whole lung is emphysematous. There's some shadows here. PIE, this is all PIE. You can see tracking from the mediastinum, going to the periphery. These are all PIE, and it's a chronic lung disease, right? So, and the third portion is right, BPD, and the oxygen index is 5. Now, mention the assessment features of NIPS. What is the total score possible in this scoring system, and what is a score which indicates pain? So the features of NIPS is the question. So how many of you use pain scoring in newborns? So I think most of you are not using pain scoring. That is why you find this question difficult, right? So facial expressions, cry, breathing, arms, movement, lax movement, and alertness. These are the features which are used in NIPS. So read about pain scores. They can be asked like this. So maximum score is 7, 4 or more than 4 indicates pain. I know it's a tough one because most of us are not using pain score. The people are using other scores like NPAS. That's all right. You should know because questions can be asked this way also. Okay. Now look at this X-ray. Look at this X-ray very carefully. So identify. Identify this X-ray clavicular fracture. I think I should show this X-ray again. People have not picked it up correctly. So let me show the X-ray again. Look at this X-ray. So there is no clavicular fracture. Now look at this. The heart is this and liver is also this. This is liver. This is heart. Heart and liver are on the same side. What does it mean? Now can you pick it up? Situs. What does you mean by situs? What is dextro? Situs inversus. So now look at the labeling. The labeling is right. So liver is on right side, but heart is on left side. His heart is also on right side. So this is not situs inversus because look at this label. Liver is right, but heart is also right. This is dextrocardia with situs solitus. So whenever you are asked to look at an X-ray, always look at the label. So this is very clear. This is very difficult X-ray to pick up because label here it is showing right is this side. So liver is also right and heart is also right. This is dextrocardia and this is not situs inversus. This is not situs inversus. This is situs solitus and this is dextrocardia. Right now you're able to pick it up. This is dextrocardia. So what is Laplace equation? What is Laplace equation? It is used in whenever we discuss surfactant or surface tension. We use this. So Laplace equation is not used in surfactant. It is used to measure surface tension. Okay, nobody gets it. So name the phospholipid most responsible for surface tension reduction. Name that phospholipid. Yeah, so Dr. Pranav has answered correctly, 2T by R, right? T should be capital, but yeah, that's all right. Phosphatidylcholine, that's right. Not sphingolipid, it is phosphatidyl dipalmityl phosphatidylcholine. That's the right answer. So let us look at the right answers. So dextrocardia with situs solitus, 2T by R, with the pressure across the wall of the sphere is P. T is surface tension, R is the radius. So as you can see, less the radius, more the surface tension. More the radius, less the surface tension. And dipalmityl phosphatidylcholine is the most active component of the surfactant, the active component of surfactant. Correct? Look at this X-ray carefully. So I'm sure all of you are able to pick it up this X-ray. So this is omphalocele major. Okay. So now the question is, name the procedure which is done if it is not possible to accommodate all the contents in the abdomen at the time of surgery. We're expected to name that procedure which is done if you cannot do the complete corrective surgery. What is that procedure called? So if you're able to put everything into the abdomen, it is a complete repair. But many times you cannot do this because the defect is so big and abdomen is so small. So you do something else. What is that procedure called? That procedure is called silo. Silo, not stage surgery. It is called silo procedure because it is made like a silo. Silo like these cold storage. You put a lot of wheat into those containers And top of the container, you have a silo, plastic wrap or a polythene wrap, and you'll tie this silo. And with pressure, with gravity, the rice or the wheat goes down, and then over a period of time, that hump also goes down. So that is called silo procedure. Okay. Beyond what period of gestation this can be diagnosed by antenatal ultrasound without doubt? You know, there is at some stage the intestines also come out of abdomen as a normal procedure. And if you do an ultrasound at earlier gestation, you will be diagnosing all patients as omphalocele. But beyond what gestation, if you do it, you always know that this is omphalocele. No, not 22, not 18. The malrotation, the rotation of the gut is complete by 11 weeks. So by 11 weeks, the guts have returned to the abdomen. So if you're seeing it beyond 11 weeks, it is omphalocele, right? So answer is 11 weeks. So let us look at the answers. Exomphalos major or omphalocele, silo procedure in 11 weeks. So beyond 11 weeks, the intestines are expected to come back into the abdomen. They are not into the sac. So I think this we can skip because this is another question. You can see this film. Look at these two metallic things which you can see on, which are pointed out by this arrow. Okay, have you seen the X-ray? Now the question. What do these arrows indicate in this X-ray? What are these arrows? So nobody picks it up. PDA ligation. So what does what does this arrow shows? It does not show you PDA ligation. It shows you something different. It shows you Jamin Kumar, you are close. Clips. Yes, that is the right answer. So device closer. Yes, they are showing metallic clips. These are this. We can go back to the X-ray. Those of you cannot pick it up. So you can see this X-ray again. These are two metallic clips which is on the PDA, right? So what is the commonest vascular ring diagnosed in neonatal period? You know vascular rings? So what are the commonest vascular ring diagnosed in neonatal period? Esophageal, no, that's wrong. No, it's not esophageal ring, no. Vascular ring. So the double aortic arch is the commonest vascular ring. So let us come to the next question. How do you diagnose a vascular ring? What is the diagnosis of, what is echo the diagnosis, the modality of choice or something else? What is the diagnostic modality of choice for vascular ring? As I told you already, the double aortic arch is the commonest. Angiography is not the right answer. CT angio can be done, but CT angio will require a dye. So MR. So MRI or MR angio will be the right choice. So MR angio will be the right answer. So metallic clips, double aortic arch, and MRI or MR angio can be the right answer for this. So 2-hour-old infant is anuric, has respiratory distress, and is on ventilator. So 2-hour-old, no urine, distress on ventilator. His mother had oligohydramnios, and several people have noted the baby has funny looks. Right? So you are looking at a baby with anuric, ventilated, oliguria in the mother, and baby has got funny look. What is the commonest diagnosis in this condition? So Potter faces, right? So you have picked it up correctly. Potter, right? Potter faces, very right. Potter syndrome, Potter faces. That is what is making it funny look. Okay. Let us come to the second part of it. So what is the rationale of getting ultrasound to the parents in this situation? So now you know it is a Potter syndrome. The mother and the father are there, they are all right, they are fine, but you want to get an ultrasound of the parents also. In what situation you get an ultrasound of parents? Okay, Nisha Agleve has answered it correctly. Okay, not recessive. This will be autosomal recessive, you said. Okay, PCKD, autosomal dominant, yes. So there are certain conditions which are autosomal dominant, and you need to rule them out in the looking at parents also. Autosomal dominant polycystic kidney disease. On examination, abdomen looks hugely distended. In this baby, name a bedside procedure which would help in your differential diagnosis. A baby who is anuric, born of oligohydramnios, looks like Porter syndrome. You do some bedside procedure, it tells you that it is, and it is not ultrasound. You're not looking at ultrasound, which is investigation. You're looking at a bedside procedure which would help you in differential diagnosis. Catheterization, very right. SPC, I will say catheterization. So that will rule out a obstructive uropathy. So right, very correct. So we look at the answers. Porter syndrome, certain disorders are genetically inherited and are dominant in inheritance, like polycystic disease or bilateral renal cystic dysplasia. Even that can be genetically inherited, and renal cystic dysplasia may not be lethal. So parents may be still alive, but you can do some benefit to them. You can diagnose it in them, and then you can treat the parents also. And perurethral bladder catheterization will rule out posterior urethral valve or obstructive uropathy or neurogenic bladder, right? So this we can leave. So what is the wavelength of spatial blue lights? Simple questions. Spatial blue light, what is the wavelength? Spatial blue light 460 to 490, 460, spatial blue 480, 460, 480, okay. So you are very close, most of you are close, right? 460 to 499, that's wrong. So it will be very close. Spatial blue has a very narrow wavelength. Okay. Next. So which principle is bilirubin based upon? What is the principle of bilirubin? 450. So you have to have a length, a range. So principle of bilirubin. No answers. Okay. Next. Name the vitamin deficiency which is caused by phototherapy. Not very serious disorder, but spectrophotometry, chromatography, differential absorption of light. B1. B1 is thiamine. Is it thiamine or it is something else? So this is not thiamine, Nisha. This is riboflavin. Okay. So let us look at the answers. So 450 to 460. So it's a very narrow spectrum. You cannot give a very broad range. 450 to 460 nanometer is the wavelength of spatial blue light. Multi-wavelength spectral reflectance is the principle of bilirubin. And riboflavin, transient abnormality of riboflavin can happen with phototherapy. So no therapy is innocuous. So don't give phototherapy to babies who don't require it, because even phototherapy can have side effects. Apart from interference in breastfeeding, psychological distress to the parents, it also can affect like rashes on the skin, loose motions, and riboflavin deficiency, which is transient. Look at this. Identify this karyotypic abnormality. I'm sure most of you can pick it up. So Turner syndrome, Turner. Everybody knows it's a single X. So it's a Turner syndrome, right? So diagnosis is correct. Turner syndrome. Name the genetic basis of Cry-Du-Chat syndrome. So that is another question. So what is Cry-Du-Chat? 50. What is 50? 5x, 5p, 5p, 13p, partial deletion of 5. That is right. Deletion of short arm of 5, right? So partial deletion of 5, 5p, that is correct answer. Okay. Name the genetic test of choice for Cry-Du-Chat. How do you diagnose Cry-Du-Chat? What is the test of choice? Fish or karyotype, which is better? So whenever you have deletions of short arm, then fish is the better diagnostic ability. Microarray, no, that's microarray is wrong. The fish will be the right answer. Right, let us look at the answers. So Turner syndrome, deletion of 5p is the right answer, and fish. Okay.